So there was a question that was set forward to us as well, why Fortis Health? You've got a lot more TRT companies out there. The prices are slightly on the lower end compared to us. It's difficult to talk about this topic without actually talking about oneself, but yes. I've been involved as a doctor for over 20 years. So my background is working as a general practitioner, but I obviously had a very much deeply ingrained route in emergency medicine and A&E and urgent care. But my other background that people don't realize, well, some do know, is I actually coach sports. I teach wrestling, or Greco-Roman freestyle Olympic wrestling, and also teach Brazilian Jiu-Jitsu as a black belt practitioner. I've been involved in Jiu-Jitsu for over at least 18, if not 19 years. Actually longer, since the late 90s. And that also has a compounding effect, because not only do I work as a physician and I talk about health and mitigation of risk and looking at comorbidities and looking at you in terms of your medical conservative therapies, I also look at you from a kind of holistic point of view in terms of your diet and your lifestyle. I had the pleasure of actually training Olympians. So in the 2012 Olympics, I had certain Olympic teams, including American Samoan team, request me to help support them in the development of the athletes. I've had the pleasure of training some of the best wrestlers from Wales. I had the opportunity for a short period of time to teach or train the South England national wrestling team. And I was the South England head coach for a short period of time. So sports is something very, very important to me, and lifestyle in that respect. And not only am I a doctor for the last 20 or so years, I actually specialized in endocrinology, which is the study of hormones. So I'd done my diplomaship in endocrinology, and then I actually done my master's in endocrinology, and then my actual paper, my thesis was in and around testosterone therapy in men, but more so specifically in women. And that could be another topic that we can look at as well. If you want to ask me questions about it, I'm happy to talk about how we can use testosterone in both the pre and postmenopausal, mainly postmenopausal, but also in premenopausal women, and how that functions. So I think when it comes to the cumulative effect, being a doctor, obviously for over 20 years, being involved in sports since I was 6, 7 years old, as well as coaching sports to a very high level, as well as specializing in the topic of endocrinology and subspecializing in the topic of testosterone therapy, I think you've got yourself a good mix when it comes to managing the aging male. And obviously me being an aging male as well probably does help quite a bit. Not that people who are not aging males can't understand the process, but it does help when you're involved and you're in that place in your life as well. Actually gives us, I think, essentially the strength, the authority and the ability to be one of the best, if not the best, TRT prescriber subscriber in the UK.